Great.
All right, we're recording. So welcome everybody. Welcome to those people who are here live with us, as well as those of you who are just watching this video because you wanted to learn more about Dr. Greenman, which I'm so happy you're going to get the opportunity to do that.
Me too.
We were really looking forward to this opportunity to this get to know you session, basically. And I'm not going to do much talking at all. I know all of you are used to hearing me a lot, and so you don't need to hear me today. And so I'd like to introduce you to Danielle Greenman.
Hi, everybody. I'm Dr. Greenman.
So this is Dr. Greenman, and so we are. So we have we're going to do a little Q&A, and so I'm going to sort of go through, I'll ask sort of the questions. We actually asked people to send in questions, and we figured we would just sort of use that kind of format. For those of you who are here with us, you're welcome to go into the chat box and put in a question if you'd like me to ask that of Dr. Greenman while we're here. And so I can take live questions. But otherwise, we have our pre-prepared questions that we put together that we thought by polling people in our office that these would be the kinds of things that you all want to know. So how about if we start with, where are you coming from? Where have you practiced previously? A little bit about sort of your background and your credentials.
Sure, that's a great place to start. So I will go, if it's okay with everyone, chronologically as opposed to backwards. So I'm coming here from Stanford Hospital, and my journey to Stanford started at Cornell University as an undergrad. And while I was there, I studied anthropology. And I was really, really interested in the cultural constructs of medicine. So who the medicine man is, and what is a healer, and what does healing really look like from a cultural standpoint. And I think, it's another conversation, but we're starting to talk about that today. And I love how kind of my education has come full circle to my practice. And after college, I spent 2 years kind of as a nomad with a backpack, traveling, learning, coming back. I worked at Dalton as a lacrosse coach because I played some lacrosse when I was at Cornell. Took a Spanish literature course in Spanish and really just made money, got my backpack, left again, and came back for medical school, which was at Robert Wood Johnson in New Jersey, which is now Rutgers Medical School. So I had grown up in a town called Summit, New Jersey, and so stayed in state for medical school. And in medical school, my interest in global health continued, and I did rotations in Spain and in Bhutan and in Taiwan, and traveled really as much as I could. But this time as kind of with my doctor hat, more so than I'm a young adult traveling the world and interested. This time I was really looking at it through the lens as a doctor. And I started learning acupuncture at that point. When I was in Taiwan, I started taking courses, and there they actually had the acupuncture, the TCM, the traditional Chinese medicine clinics, part of the allopathic, what Dr. Blum and I, MDs, are allopathic medicine, part of one thing. So any stroke patient per se would get a consult from the acupuncture team, and it was all coordinated, and it was really quite fascinating. And I worked in an eye clinic in Bhutan, and was working on cataract surgeries with a cataract surgeon. And then I went to Yale from Rutgers, and I was in their internal medicine primary care program. So I spent 3 years in New Haven. And while I was there, continued international health. I spent about 2.5 months in South Africa, working in an HIV clinic, passing out antiretrovirals and doing the urgent care. So like if one of the patients who were registered had a pneumonia or a lung infection or was pregnant, they would be kind of under my supervision and care. And then from Yale, I ended up in Stanford, and I'm sure we'll get into that story too. And Stanford had a joint program with Columbia doing integrative medicine. So I did 2 years training in integrative medicine while also doing the University of Arizona integrative medicine fellowship under Andrew Weil. And then, so I guess in between those two, actually, I had done a short period of time at a primary care site as a general practitioner, your PCP, your primary care physician, in an underserved population in Stanford as well. So I was a primary care doctor, and then I realized that most primary care and chronic conditions need a lot more TLC than primary care doctors have the ability to give. And so that's when the fellowship started. And then over the course of those 5 years, Susan and I had met several times, and then now I'm here with you guys as part of your care team, which is pretty special.
Well, excellent. And I will add that one of the things, I mean, you're such a full, interesting person in so many ways, and not just like a pigeonholed clinician, like conventional doctor. And the perspective of all those different healing traditions is something that I know that you value in your training, and that I've come to really appreciate in your skill, what you bring as yourself to your medical practice. As you know, as we all know, like, we bring ourselves, right? It's like who we are and what we've learned and what we've become, and like our approach, like this all goes into the secret sauce, for like how we work with people. And so you have just this interesting sort of sauce you've created. And so yeah, you and I spoke for a long time, well, intermittently for the past several years. Will it work for you to come to Blum Center? And so the timing, we always joked that the timing would be right someday. And so the timing just ended up right. But can you share with everybody, like, why for you, you decided to come to Blum Center?
Absolutely. So I had been committed to access to care. And unfortunately, access to care sometimes means sacrificing time and details in an insurance-based model. And so one of the, before just why Blum, but why private practice first, was that I don't really think it's possible to deliver the care that patients need within the constructs of the system. And so for those patients that have out-of-network benefits, it's a great, we're documenting the same. So at least you can submit if it is a benefit. But at the same time, for the patients that are choosing to really invest in their health and kind of consult with us, I just think that the care is better. And do I imagine a world in 20 years where what Dr. Blum and I do is a different model? Maybe, but right now it just doesn't exist that way. And so why Blum? And why private practice? So one, there's a team, right? You're not just seeing your one doctor in and out 15 minutes and then you're done. You have Melissa in health coaching and
Vicky.
And Vic, pardon?
Vicky, yeah.
Yeah, and Vicky in our dietitian, and you have Sabrina and Sarah and Lindsay in the front. And so there's a whole team that really is committed to taking care of every patient. And over the 3 years and a half that Susan and I had been speaking, that was very clear from the moment I stepped foot in. And I didn't want to work in a siphon by myself, just with my patient, because I don't think, well, I do have a skill set that is valuable. It's not enough to do it alone. You need the skills of your team to really, from check-in to check-out to follow up. And I like your team very much. I think everyone is smart and engaged and caring. And then, there's the benefit of the three physicians who are still there. So Dr. Blum, Dr. Yee, and myself. I think having the ability to know that the three of us, even though you're just speaking to one physician, you're getting the input from the whole team and the other medical brains. And really, you and Dr. Yee are two of the best medical brains that I know. And so why not be able to put my brain in there with you guys? And so those were some of the big attractions, and the fact that we can personalize treatments and make it fit for the patient because you have access to the team. And I think that's a really special and unique resource, not to have anything cookie cutter.
Yeah. Yeah, and thank you for that. I mean, I definitely am sort of proud of, and in functional medicine, we're not the only place that does this pod approach, and so definitely having the team is so important. And so that's, I think, I've been doing that for a long. I think parallel worlds in functional medicine and probably integrative medicine, or just we've been figuring out the team approach is so important.
Yeah.
And yeah, we're so lucky that we have really a great group of committed people, and operationally, I think we're humming, right? We have a good humming,
Yeah, it's
team.
been 10 years of humming.
10 years of humming. And so, and I just would add also that my experience of what getting to know you, and what I'm excited, one of the things I'm excited about for you also to join Blum Center, and this comes into your texting me this morning about an idea that you had, right? Is that we've done a lot of ideas and started new programs and had, but you're like creative and you have ideas, and I'm really looking forward to putting some of those sort of ideas into place, right? And we have a good team to help you implement them, right? And so that was another thing you had said to me, right? Is that you have all these ideas and you just need help doing them.
I think that was one of the hardest parts about being in Stanford. And while I love every minute of my time there, being part of the system to make an idea come to fruition, there's a lot of cogs in the wheel.
Right.
And so at this point, if one of the patients says, why don't we do something like that? And that sparks an idea, we have the ability to at least see if it works and give it a go. And if it doesn't, then you either come up with the next iteration, or it was an idea that didn't work and that was that. But
right.
Yeah, it's I think it's important to
be nimble that way
with time and patient needs. And the number one thing, when I was driving home yesterday, I had this idea for something and I called Susan.
Well, you can share. I mean, it's really about just doing a workshop.
Yeah.
Right?
But the question is, the three physicians wear patients too, right? And so what would I want from my practitioner? Because at the end of the day, we're all humans with human needs, and what do we desire, and how can we find community and healing and health? And yeah, I love that we can just have discussions that incorporate that.
Yeah, and that we have the opportunity to try new things. And
exactly.
That always made me happy too. I did a 2-year brief stint working part-time before I opened Blum Center at Greenwich Center for Integrative Medicine. It's like they were trying, Stanford at least took off and became really successful.
Yeah, a wonderful place.
Greenwich had to close, but the medical director there, who was my dear friend Henri Roca, he was hamstrung. He would have an idea and he'd have to go through a whole board in order to be able to make it happen.
Yep.
And me as the medical director, I'm like, I have an idea, let's just do it, right? Exactly. And so there's something really nice about that. And for all of you listening, tell us what you want, right?
Yeah, exactly.
We're listening and we're very flexible. We were just talking about doing a thyroid workshop. People would like that. And so, and what would it look like to have an in-person, believe it or not, an in-person again workshop? But I built Blum Center. I mean, it's been so sad for this past year that it's been empty during the pandemic. We've had this big teaching kitchen and our big community space. I built a big community room. And so what would it look like to get that going again, and to even imagine that we would get that going again? It's definitely is exciting to me to plan like that. So we have I found a kindred spirit in sort of the
In
dreamer,
many ways.
the
Yeah,
ideas, and being flexible and nimble. And then we have a great team to help us do those things, which is really great.
exactly.
Okay, so maybe we should switch into sort of your love of medicine,
Sure.
right? And so maybe first a general question about like, what do you love about medicine in general?
Mhm.
And then maybe then even and speak to you bring in additional modalities, right,
Sure.
to your practice. And then
Yeah.
in terms of the conditions, what you liked, what kind of listen, you and I are both generalists, so we see everybody. So when
Yeah.
people say who do you want to see, it's a tough question to answer, but
The toughest.
you can do your best shot at that.
Okay.
Yeah.
So I think so that the patients who are kind of coming on board to work with me, I think it's important to understand what I love about medicine in general and how I got to this specific place
Yes.
as a functionalist and an integrativist. So I can't tell you the exact moment I knew I was going to be a doctor, but it started as a little girl. I had the stethoscope and the reflex hammer, and if you came into my parents' house, you were getting an exam by me. So the desire, the calling, I will say, was there from as long as I can remember. Did that have anything? I had something called a thyroglosal duct cyst. So essentially, when you're a fetus, or really an embryo, the thyroid gland goes from the back of your tongue to, it migrates down into where it sits at the base of your neck, right? And so while it travels, there's a code in the system that says all those other cells go away, and they are programmed to die, but except for the thyroid that stays. I had an anomaly. My cell program death didn't work. And those thyroid cells, I had extra thyroid cells that grew where it wasn't supposed to. And so at 4 years old, I found myself overnight unable to breathe in a hospital getting the steroids. And then 2 days later, they were like, yeah, let's operate, right? And so, did it stem from that? I can't remember. But certainly, I clearly remember that whole experience very well, and I loved that my doctor brought snuffleupagus into the operating room, right? But I was called to serve as a physician because I knew at a young age that as a doctor, you were a partner with your patient to help them feel well. But I don't really think I understood until I was in college. I loved ortho. I loved orgo. I loved the chemical pathways.
What's orgo for people who?
It's a type of chemistry. So it's how the cells work and function, and they call it the weeding class. So most people take organic chemistry, and then they're like, forget this, I'm not going into medicine. But I loved it. I had a group of medical, pre-med, and we geeked out overnight in the library till God knows what hour, putting the pieces together. And that was the first time I realized that medicine was a puzzle, down to the organic chemistry of it all, right? And then in medical school, you learn more and more how to think through the problems and the puzzles, and that fit very well with the way I like to think about things, from a systems base to down to what makes the system whole, and then of course how to bring that into the most human, real thing in the world, which is human beings, right? And so how do you take all of this knowledge and problem solving and hold a patient's hand while you have an understanding of how things work, but the other person is coming to you as a translator, but not just to explain it to them, but also to help figure out what's wrong. And so for me, I think one of my strengths as a physician and one of my favorite parts of being a physician is being the translator. So like, it is my job to explain things until whoever I'm explaining them to understands, right? So if you leave my office and you don't understand why something's not working the way it does, I didn't do my job well. And I owe you more time to figure out a different way to explain it. And I take that really seriously. And I really, I like that about medicine, very genuinely. But that takes time, again. So why this form of practice, you can't explain things in 10 minutes, 15 minutes. It doesn't work. And that's why patients don't follow through on plans, because I wouldn't do something if I didn't understand why I'm doing it. So yeah, that's the long short of why I love medicine. Why I love this kind of medicine, integrative and functional, is because number one, it works. Number two, I think this is the way, I mean, Hippocrates said healing starts with the gut, and that was what, like, I don't even know how many years ago, 1,000 years ago, more. And I don't think, so this functional and integrative medicine became a need because traditional medicine, after the advent of penicillin and antibiotics, it became a pill for every ill, right? So, okay, we've now discovered if you have an infection, I can treat it with an antibiotic. So can I use that thought process for all other systems of medicine, right? So if you have any problem, can I throw a pill at it? And sometimes it works, but it's so much more than that. Like, without understanding how you sleep, what your childhood was like, what your family dynamics like, who's your support system, how do you move your body, what are your patterns of thinking? It doesn't matter, you can't give a prescription or a supplement to fix that. And a lot of times we need supplements because our food is void of the nutrients and the system has broken down. But yeah, if you don't look at it from a holistic perspective, it doesn't work. And so I came to learn more and more about herbs and supplements and acupuncture and meditation. And I really found my way there with a personal struggle. I was an intern in residency. So intern is your first year of residency. So after college, you go to training as a resident, and that's usually for internal medicine.
After medical school.
After medical school. That's a 3-year program. That's when I was at Yale. And my first year, my dad died very, very suddenly and tragically, and it was really traumatic. And I was trying to be a good doctor and a good student, and you don't really have time and space to heal the way you need to. And finally, I went to my program director, who still to this day is one of the most special human beings to me. And I said, I think I just need to take a little mini break. And I took a 2-month sabbatical, and I didn't know what I was, till the 2 days before the sabbatical started, I was working in the ICU, Googling like yoga retreats. And I found one in Mexico. And I'd never done yoga before. I had never meditated before. And I showed up in the village without having registered as a student. But it always works out. And if it didn't work out, something else would have worked out. And I learned to move my body mindfully. And there was a moment where just nothing changed. I was still a daughter without a living father, right? And the circumstances were the same, but my perspective of it shifted and my ability to cope changed. And then I came back to Yale and I started a research project on something called MBSR, mindfulness-based stress reduction. And from there, it was, I was hooked.
Wow. I didn't know that about you.
Yeah,
Thank you for sharing your story. That was really,
absolutely.
that's a really beautiful sort of journey.
Yeah, it was really, I always say it was, if you choose to look for what's right about a situation, every illness, every death, every birth, there's something right or something that we can learn from every
Right.
struggle, right? And so sometimes I'll have, if you're my patient, I'll have you go like, who else is in there? What's right about that? Right? And, what was right about my dad's passing is that it really gave me the gift of integrative medicine.
Wow.
And I don't know if I would have found it without
Right.
that suffering.
Well, and not only that, but you know, a lot of us in the field of integrative and functional medicine, like we learned on ourselves. Like that's how we got there. Is something
Sure.
happened. For me, it was my Hashimoto's, you know,
Mhm.
my autoimmune thyroid 20 years ago. And
Exactly.
so I think, which I write about, I think my autoimmune book is where I write that whole Hashimoto's story. And so I think that, but so those are gifts in some ways, right? Because they help bring them, not that we wouldn't maybe want to change something about it if we had a choice, but
Right.
yeah, so bringing ourselves fully to our practice of medicine because of who we bring, who we are, and what we've learned, and our journey, and I think that's really important because we're human, right? We have relationships with our patients. It's not, and I will say that, and I know this about you too. Like we really try. Oops, sorry about that. We really try to, you know, keep things very casual. So it's not this white coat syndrome, certainly in our office.
No, I would say I know a lot of the intimate details about my patients' lives that they choose to share with me. And I genuinely care about all of them. And sometimes you find yourself driving home from work and you're like, oh, I wonder if such and such daughter ended up doing okay on that test.
I know. And so that's one thing I really am grateful for too, by having time to spend with everybody, is I enjoy getting to know everyone and hearing their stories, and we're friends in some ways, right?
Yeah, absolutely.
And so there's relationships that we build, and I love that about the practice of the way we practice as well, that we get to nourish those relationships, which is what I think I hear you saying as well.
Yeah, without a doubt.
Yeah. So what do you love to do in medicine? Like, I know, well, first of all, I know you love to stick needles in people
I do
who
love
who
to
are in
stick needles
pain.
in people.
In addition to your basic functional medicine stuff, excuse the cat who's climbing on my desk. So tell everyone about, I know there's all sorts of things you treat.
Sure.
But one of the ways we initially met is because in addition to your sort of brilliant put the puzzle together, figure out what's the cause of the problem, functional medicine piece, there's also this love of doing therapeutic work. So maybe you can share a little bit about that.
So I think that someone once told me that the fascia is the mind-body connection part of that. And it was one of the most interesting moments. The fascia is like, it's the saran wrap that surrounds your muscles, and it's the electrical pathways that run throughout your body that you can't see with the naked eye, but you can with a microscope. And there's some YouTube videos on surgeries that have been done. But if you believe that, which I do very strongly, that the mind and the body are connection, and that if that fascia is that pathway that connects us, then if we can find a way to help treat the fascia, can you treat some of your pain or anxiety or headache or gut symptoms by working on the fascia? And I think thousands of years of acupuncture will tell you yes. And so that was part of my love for acupuncture and trigger points, which are dry needles, essentially finding a point of muscle constriction. Actually, I just gave my husband some before this meeting. His back was hurting him. But yeah, I do like sticking needles into people because I think we're working on the fascia we're working on energy systems. And, you know, anyone who tells you that we're not energetic beings should never go get an EKG, because right, we keep electricity. We really do. Think about when you know, I have static cling, I have my hair standing up. That's all electricity. And so we are electromagnetic beings too. We have charge. And so, you know, when I was a kid and I played competitive sports, if we got hurt, we were at the acupuncturist. And so it was part of my, I guess, belief system growing up, because it worked. You know, my knees and my shoulders and my neck were always getting fixed up by the acupuncturist. But it's such a valuable tool to give to my patients. And so I'm excited to be able to bring that to the center.
Yes, and me too. But and part of it's also your view of pain, like working with pain and how you work, because we don't I always felt that's something that I've always felt we were missing, you know, is really someone who could help our patients address pain in a different way.
Yeah.
You know, because we're really good at finding all the sources of inflammation, systemically reducing inflammation, and that's all well and good. But there's something that needs to happen to help the musculoskeletal fascia, whatever you want to call it, the physical body.
We call it total system breakdown.
Yeah, okay.
Where I'm
That makes
coming
sense.
from. And so it's the myofascial, the muscles and the fascia is connected to everything, right? And so when you sit for too long and your back hurts or your neck hurts, or you had that car accident 10 years ago and you still get headaches, you know, acupuncture can be a major partner for you in healing. And then what are the other kind of body workers that we can find to help you? And that's always based on a patient's interest level. And
right, we can make those referrals. Like we're pretty good at and you have a whole network of people that you're bringing to us as well, which is great, because from the Connecticut side.
A good Connecticut side, and some of them had a good Manhattan side. So I know we have people that are close enough, but Fairfield County.
No, it's all close. And we have a lot of patients who come from Connecticut, and a lot of people who come from the city, like people from Blum Center, where, you know, it's everywhere.
And now that I'm in Westchester, I'm going to start sniffing out the good body workers here too.
Right. And we can help you, because we definitely know a bunch of them too. All right, good. And so in terms of the functional medicine piece, what are your favorite things to work with? I mean, you know, in terms of that whole, what conditions do you treat? Like, what do you specialize in? If you had to describe somewhat of your favorite things, like what would they be?
I think, as you said, we are generalists. So I always find that to be my hardest question, because I look at the body and every condition as a breakdown of the whole. So if your hormone system isn't working, and I love treating hormones, so things like PCOS or PMS or
thyroid, adrenal, menopause, like the whole endocrine system.
Helping women get pregnant. So that's not really just the hormones, as you know better than anyone, like that usually relates to the gut and to stress levels. And so I love treating the gut because it also relates to the hormones. So your thyroid and your estrogen levels and your testosterone levels. And I find nothing more satisfying than helping a patient who's in pain break down those pathways and help them find relief. I think what we're learning about chronic pain being more of a neurological condition as opposed to a physical condition, which is like, what does that even mean, right? You're saying it's in my brain. And yeah, one of the most influential pain scientists once said to me, no brain, no pain. And which means like the modalities like mindfulness and meditation and reprogramming are so helpful in treating pain. And then I always enjoy my needles again. Using Botox for chronic neck pain and clenched jaw, I find that to be kind of a temporary fix while we get into the work of the cause of the tension. But a lot of migraines and clenching is a stress-related condition. So if we can force the body to release with Botox and then learn some of those lifestyle changes, and that's where Melissa would come in, really make wonderful progress.
Right. What about things like autoimmunity and,
Yeah.
you know, because we do a lot of that and inflammatory conditions and
Yeah.
arthritis. And all of that.
Absolutely.
Yeah.
I think that goes hand in hand with, I think the immune system is fascinating. And I think the immune system is obviously 70% of it comes from the gut, right? So yes, I love treating autoimmunity because I think working with the diet and healing the gut can be so effective in that. So again, it's such a hard question for me because it really is the system as a whole. So I can right where, well, why are you talking to me about, you know, my periods when I'm talking to you about my thyroid or my joints hurting? But yeah, it's all connected.
Right. I mean, it's really internal medicine from a functional perspective. So
Mhm.
it's really everything. It's rheumatology and immunology and gastroenterology. It's like all the subspecialties of internal medicine in some ways, really.
Exactly.
Which are all these things that that we are trying to figure out
Yeah,
what the underlying cause is so that we can address those underlying causes
without a doubt.
with the modalities that we do. And that's the Hippocrates other saying, right? Let food be thy medicine and medicine be thy food, right?
Exactly.
So nutrition and food is so
And
critical.
speaking of nutrition and food, one of my interests that is newer to me, but something that I'm starting to dig deep in, is the nutrigenomics. So understanding one specific genetic mutations and understanding what one should eat or supplements they should take that really fit with that genetic workup. And I think that's just the future of personalized medicine, and I'm excited to keep diving deeper.
Yeah, and that's a very good word. That's a good word to bring for us, you know, to bring forward is personalized medicine,
Yeah.
right? Because that's really what we're doing. That's what we're working at.
Yep.
So that we don't keep, I think that's probably enough. Is there anything else you want to add about like the practice or an example of a puzzle you solve with a patient, maybe, to give
Yeah,
people
you had we had talked about, you know, what would be a really interesting case, and I had two cases that came to mind. One was a patient who had a weird rash on his ankle. There's a term called petechiae, which is when almost like, I mean, for lack of a better descriptor, but if you've ever seen a hickey, right? That is
broken blood vessels, like
blood vessels, bruises, right? And this patient, young 60s, healthy 60s, came to me with a swollen ankle with petechiae all over his ankle. And, you know, I went back to the literature. He didn't, nondescript abdominal pain. We went through his whole life, and he had lived abroad for a little while. And I thought we needed to look at his gut and his stomach. And it turned out he had a bacteria called H. pylori, which, you know, I'm finding more and more in the community, which I find really interesting. And I'm wondering why. And I think maybe just dysbiosis, so abnormal gut bacteria. But we treated his H. pylori. There's like 3 case studies I found that linked this kind of autoimmune vasculitis as a side effect of H. pylori, which just again goes to show you the immune system in the gut is inextricably linked, but it's designed to be together. And so that is one of the cases that sticks out. And one of
and so when you treated the H. pylori, his rash went away. Yeah.
Completely. He was totally fine. Swelling, joints, no, like mobility in his joints returned. You know, we had to work on healing his gut after the H. pylori because more antibiotics and blah, blah, blah. But yeah, it took, he felt better almost immediately. And he didn't realize how bad his gut felt until it felt better,
Yeah.
because it was
It's
just
very common, right?
fine.
When we're
Totally
working with
common.
people. Yeah.
But that's one of my favorite cases.
Yeah. Okay, cool.
Yeah.
Well, nobody's asked any questions, so I think maybe from the medical side, I'm just trying to think if there's anything else I didn't ask you that I wanted to. I think we really covered it. It's I really appreciate you sharing your story again with us in terms of, again, with me and newly for everybody else, about, wait, I'll come back here. In terms of just, who you are and where you came from and how you ended up in medicine and what you love to do. Seriously, you remind me of myself, and it's like very hard to pigeonhole, like what I did write a book on autoimmunity because I was seeing so much of it and I wanted the world to know, that you don't have to just go to a rheumatologist and take really medicine to treat your symptoms.
No.
There's actually root causes of autoimmunity that we could address.
So much.
And so, so I ended up in autoimmunity and inflammation a lot, but by default, but still everybody comes to see me and send their family, and everyone listening, I would invite you to do that. Dr. Yee, so one of the things I love to, which you'd love to do too, is like preventive cardiology, right?
I love it.
Like lipids and making sure your cholesterol and your risk factors and making sure we're addressing your heart disease risks and family history.
Yeah, I believe that everyone should have a primary care doctor and us, and you should see both of them every year once, and just like get a holistic approach. I know that's not necessarily.
Well, I talk about getting a good look under the hood, right?
Yeah.
So everyone needs like us, right, to look at their labs and look at them in a different way, which we do, because so I'm board in preventive medicine. That's like I love to say that because we're doing prevention in functional medicine anyway. It's that's why it was a natural place for me to land, because we're looking at that gray zone in the middle, right? It's not disease and you're not 100% fine. In some gray zone, something's not working right. And if you pick it up there, then you can prevent the disease.
Right.
And so that's why preventive cardiology, in terms of doing advanced lipid testing and stuff, you can really pick people up and screen them earlier before something happens.
Absolutely. And understand that it's so much, a patient comes back with a high cholesterol level, but they have a great diet. And then we find out, well, you just have these big fluffy particles, not these small sticky particles. So don't worry about the number. Right. Again,
or we find out they have bad genetics.
Right.
And we need to actually, even though it seems like we shouldn't need to do anything about it, but maybe we do. Right. So
both sides.
It's all of that. And so somebody needs to be thinking that way, and so we do, right?
Exactly.
And so, and thankfully, like Dr. Yee, who's the third, you talked about her at the beginning, she's our third leg in the stool for Blum Center, our third doctor. She takes on she's really loves cancer and she loves Lyme. I mean, we do a lot of Lyme testing, as well as I know, pick up a lot of Lyme as well. But Dr. Yee's really we like to give Dr. Yee the chronic Lyme people, which she really loves to treat. And
I think mast cells are becoming more and more part of everyone's practice.
Yes.
And post-COVID, right? Which is a mystery and a puzzle in itself.
Yes, exactly. And so, and that'll be a good place to sort of end this part in terms of, then there's the really complex, complicated people, which we roll up our sleeves and we try to figure out: mold, mast cell, chronic Lyme,
Exactly.
I mean, we see everybody, and I know you do too. And we're all sort of in there, sort of doing our best to help people and doing pretty, and actually, I think our track record is getting better and better, and we're doing pretty good with that.
Great.
As the tools and the understanding about these sort of new syndromes, inflammatory response syndrome for mold and all that, like it's all getting better. There's a question, a couple of questions. So from Jacqueline, have you worked on white blood cells and why they might be low? So maybe chronic low white cells.
So I think that that's always a puzzling question. Yes, I have worked on it. Yes, I have explored that. And I think it's always multifactorial, meaning there's never just a one reason why someone's blood cells are suppressed. or just lower than the lab tells us to be, but they're really okay. And we look at the different immunoglobulins, and also if the lab shows that the white blood cells are low, are you getting infections? Are you able to fight infections? Is it clinically relevant, or is it a number? And I think that's always really important to remember.
Yes.
Like sometimes the labs are just reference ranges, and not everyone falls in a reference range. But if you don't feel well and you're getting recurrent infections and your immunoglobulins are not normal, that's another story.
Right. And I think that, oh, that was weird. And I think that for low white count, definitely, some people, that's where they end up and that's where they stay. And it might be because you had an old infection from a long time ago, whether you had mono, Epstein-Barr, or Lyme or something.
Right.
And so when it's some people, I just, despite all my efforts of like looking for infections, and I look for like latent infections, I assume there was some sort of a virus or an infection at some point. That brought it down. And then sometimes it just stays there. And like you were saying, that's like their normal, right? But but I think that, as you said also, like we do look and see if there are latent infections that might need to be looked at. And sometimes it is a sign in someone who had Lyme before that maybe we need to do more, like you said, immune workup, right? To see if there are other parts of the immune system that are a problem, right? We can go looking for immunodeficiency and make sure everything's working. Right. And if it is, then it's just the white count and maybe it hasn't bounced back, but we do dig in, right? Dig into it.
Without a doubt.
Yeah. And that's why sometimes when I have a new patient, I sort of laugh to myself, like when I have a new patient sometimes and their first blood tests come back and they have a white count of 5, I'm like, yes, you have like a normal white count. Like you don't have old infections. Like we don't have to, like, it sort of takes something off the table for me. So this is sort of how I look at blood work now. Like there are things that just, when I see they're really good, it just, oh, good. You have that. And oh, your iron is good. Oh, you don't have malabsorption. Probably your gut isn't so bad, you know? And so there are things we can celebrate and things we need to dig into more. Let's see. Please describe how you'll pick up serving, helping Elizabeth's patients. Thank you.
So, yeah, that's a great question, Jose. Are you still there? Yes. So number one, I think the meet and greets have been really great. So if you are one of Elizabeth's patients, please sign up. And it's just 15 minutes for us to talk, just like I did today, for you to have, if you have more specific questions for me about my practice. But so that when we sit down, I'm not a stranger to you. And I have, just because Elizabeth isn't here doesn't mean I don't have the ability to call her with a question if there's something going on. But also Elizabeth wrote great notes on all of her patients, and I've read through from beginning to end every email, every correspondent, every lab. So when you sit down, you're not starting over. You have a fresh set of eyes, which is sometimes a blessing. But I know what it's like. I feel for my patients that I'm leaving now. That was your partner in this healing journey so far. And then all of a sudden there's someone new holding your hand through it. So number one, let's say hi, so I'm not a stranger. Number two, please trust that I am going through the chart and learning the numbers and the tests and the plans that have been made and the supplements and the meds. And then we just pick up where you left off. And, I might want to ask some different questions or hear your story again if you're comfortable sharing it, because I think it feels weird to have someone just have read the story and not heard it from the horse's mouth. So I want to hear it from my patients' mouths. I want you, if you want to tell me your story, I genuinely think we pick up more details every time you share, and then we move forward. And that's, pick up where you are.
Yeah. I think that's beautiful. I have nothing to add to that. I mean, that's really what we're doing. And we've been really reaching out and doing the best we can. We miss Elizabeth. I mean, she's been with me from the beginning. And I will say about Elizabeth is that she interviewed Danielle, Dr. Greenman, and
For
she was
years.
thrilled that this was who was taking over the care of her patients. And it was hard for Elizabeth to move on to what's her next stage in her life and leave everybody. But I feel really good about, you're in really good hands, and not just good hands, but the kind of spirit that Dr. Greenman brings to this is Elizabeth. There'll be a sense of home that you will feel with Dr. Greenman in the same way you felt it with Elizabeth. And so I think it's a really good, I'm really happy that in particular, you are taking over her practice. And so for all of Elizabeth's patients out there, I think you will, I know that that sense of connection and how the groundedness that Elizabeth brought to the care of everybody and her presence, I'm confident that you're going to feel it too with Dr. Greenman. So as we wrap up, anything you want to say about like your interests outside of medicine? Just
Sure.
Just a little bit about you, and then we'll sort of let everyone go. Yeah.
Cool. That's always a fun question.
Yeah.
Well, clearly I like to travel. That's one of my, it's in my soul, to learn about other places and who was there, when they were there, why they were there. I love my family very deeply. I'm very committed to my husband and my son and my sisters and my nieces and my nephews and my mother. They are on my priority top, and they bring me joy, and being with them brings me joy. And so I'm lucky to have that support system. And so tomorrow we will be teaching my 4-year-old nephew how to play baseball in the park, and that will be a wonderful way to spend a Saturday. And food. My husband is in the food industry, and we love to eat, we love to cook, we love to explore how food and culture, I think food and travel go together. And I love music, all different types of music. If you are in my home, it is uncommon that you will not hear something coming from the ceiling, whether it be classical music or Bob Marley. But
Good. That's awesome. I think, and also I always feel like I could do better with music, and always appreciate learning, hearing tips and people's favorites.
Well, we can share a Spotify playlist.
We can share a Spotify, or teach me how to do Spotify.
You got it. You teach me Outlook.
I'm aging myself when I say that. I have Apple, I have an Apple subscription, so I can find stuff, but yeah, I haven't gotten myself there yet. So looking forward to you helping me with that.
Deal. Easy.
All right. So motto or words to live by. That's a tough one. As we wrap up.
Yeah. I'll think of a few. My dad used to tell me, reach for the stars, but be satisfied that you got to the treetops, which I think can be looked at in so many different ways. And you got to celebrate your successes wherever they are, and never stop reaching, but never be disappointed with yourself where you end up, because you really are exactly where you're supposed to be at any given moment.
Well, that's good right there.
Yeah, let's leave it at that.
I think we could leave it at that. I like that. That's terrific.
Leave it at that.
All right, good. Well, thank you everyone for coming. Jose, will this recording be available to view again? It absolutely will. What we're going to do is it's going to get saved, and we are going to send it out with a Meet Dr. Greenman email that you'll be getting in the next, maybe Monday, actually. I'm thinking it's going to go out. We're also going to find a way to put this up on our website where Dr. Greenman's bio is. It's sort of a new way to learn more about somebody. Since we did this anyway and recorded it.
Maybe I'll even make a playlist.
Wow. We can put it to music. Well, but was talking, so the playlist might be hard. And also, Sarah's saying, and also YouTube. So it'll be on YouTube, which will be great.
My first YouTube.
Her first YouTube. So she's going to be everywhere. So so you will have a very easy way to see this again. And so thank you all for coming on in.
So much. Thanks for sharing your Friday afternoon with us, or whatever hour you were watching.
Yes, that's true. For us, it's Friday afternoon, which is, we wish everyone a good weekend, and whoever's watching at any time, thank you for joining us. Exactly. And come on in. And if you want to learn, and actually I should, well, you have, wherever you're seeing this, you're going to see links, I'm sure, to ways to learn more about joining as a patient. But all you need to do is call the Blum Center for Health, which is, I don't need to give you the phone number because it's going to be written everywhere, but call Blum Center for Health, 914-652-7800. Well, those are the new, for those of you who are listening to this here today, a lot of you are Elizabeth's patients, we know, but some of you listening to this now just have never been here before. So come and join us, and you can email us, and there's all sorts of contact opportunities that you will see on our website, blumcenterforhealth.com as well. So learn more about us, come on in and see us. We look forward to helping you with your health journey. I think you said it before, which is a nice way.
Yeah.
Okay.
Thank you.
All right. Thank you, everyone.
Thanks, everybody.
I'm going to stop the recording.